How strong is your heart health knowledge? Let's test your heart smarts with a few facts or fiction statements. The answers will lead to a healthy heart. Let's get started. Exercise needs to be difficult. Fiction. Exercise should be enjoyable. The American Heart Association does recommend 150 minutes of moderate exercise every week. That would be 30 minutes 5 times a week of exercise that might make you a little bit flushed or a little bit winded. In fact, exercise doesn't have to be what we traditionally think of as exercise. Cleaning the house, gardening are all forms of an active lifestyle and beneficial exercise. Chest discomfort or pain do not always occur with a heart attack. Fact. While many patients will present with chest discomfort or arm pain as their symptom of a heart attack, not everybody does. The symptoms can vary. Some people will present with more atypical symptoms, such as jaw discomfort, nausea, or shortness of breath. If you feel like you might be having a heart attack, please always call 911. If you don't have a family history of heart disease, you don't need to worry about your cholesterol level. Fiction. The American Heart Association suggests that starting at age 20, everybody should have their cholesterol level checked every 5 years. While cholesterol is not the only risk factor for heart disease, it is an important risk factor, and modifications with diet or exercise, and sometimes medications, are necessary depending on your cholesterol level. Everybody needs to take an aspirin once a day. Fiction. Aspirin is an important medication, and it can help prevent heart disease in some individuals. Aspirin needs to be prescribed by your provider. Talk to your provider, and they can assess your risk of heart disease and whether or not you would benefit from a daily aspirin. Salads are not always healthy. Fact. While salads can be an important part of a heart-healthy diet, they can also be loaded with excess calories. Fruits and vegetables and healthy oils are recommended to reduce the risk of heart and vascular disease. However, we need to be mindful of our choices and our portion sizes. I don't add salt to my food, so I'm taking care of my heart. Fiction. While it can be very important not to add salt at the table, we also have to be aware that many of the foods that we get that are processed or from a restaurant often are very high in sodium. We need to be aware of how much salt we're getting in our food, not just what we're adding at the table. I don't smoke, so I'm not going to get heart disease. Fiction. Smoking is one of the most important modifiable risk factors for heart disease. But there are other risk factors as well, including diabetes, high cholesterol, and weight. It's important that none of us smokes cigarettes, but we also have to be aware of these other risk factors. Thanks for joining me. Heart disease is the #1 cause of death in the United States. But there are steps you can take today to reduce your risk for heart disease. To learn more about taking care of your heart, go to conehealth.com/heart. I'm Dr. Jake Hochrein.